coming to the treatment aspect, how the treatment is planned for suppose a patient comes, based on Marma Chikitsa, we want to go with the treatment. How to plan a treatment, or how do you
in clinical practice? There will be two types of cases will come. One is the sudden injury, acute cases. So in acute cases, we can manipulate it there itself. If some injury has occurred in some wrist or some problem is there and the hand is shivering like that, so we can manipulate it with the marmas. And if the injury is severe and it resulted in any anatomical derangement in such an extent that there will be ligaments or snayus or sandhis will be displaced, then it has to be immobilized. After placing it in the proper way, it has to be immobilized, and we have to give internal medication to reduce the pain, the swellings, and helps those which in the regeneration of these particular ligaments or meniscus like structures. So second part of the patients, those who are coming with the chronic diseases, just like gradirasis or cervical spondylitis or tennis elbow or carpal tunnel syndrome like cases. So on these cases, there will be a long history of some other disease also. So we have to look into the other marmas which will causing these problems. So on that time we can see that there will be hard swellings on the other marmas, primarily marmas of the back. So on that case, we have to first go for Dipana Pajana treatments. And after Dipana Pajana treatments, we have to give medicines, those which helps to loosen the swellings. And when the swellings are loosened, on that time we can start the massages on this particular part, and we can manipulate. If there will be a derangement is there, anatomically changing will be there, it can be manipulated in a particular way. And at the same time, for the protection and the regeneration of that particular part, we have to give the bandage and pour the oil. So on that stage, we have to incorporate regenerative medicines also. The regenerative medicines which helps to fast regeneration of these tissues.
So as I understand, the treatment involves oral medications and regular Ayurvedic massages, Snehana, Svedana and other therapies, and also some bandages. Apart from these, is there any technique like pressing on pressure points or something like that? Can you please elaborate?
One thing just I want to clarify is, Svedana here means the Svedana with the hasta.
Okay.
That much of Svedana is needed for that particular part. Sometimes more than that Svedana will harm to these marma points. So these hand Svedana with oil, if you having a heatness that get by the hand, that is the ideal Svedana needed for the stimulating the marma points.
Okay.
So second thing.
And is there any technique of applying pressure on particular points to heal?
Surely. There are different types of pressures for different marmas.
Okay.
So by this much part of the hand, there will be 5 basic movements are.
Okay.
So each points, just like pressing deeply, just like sliding movement, just like the movements like on the sides of that, and just like pressing and sliding. These types of movements are necessary to stimulate each and every marma points. So the body is protected by the God as that it has not affected with such type of disorders. So whenever there will be a need of stimulation, we have to keep the body in a particular way. If we want to stimulate this marma, we have to keep the hand like this, and then only if you start the stimulation, it will be affected. Otherwise, if the hand is like that and you go for stimulation, that marma will not be stimulated that much. So for each marmas, there will be stimulations will be different. So on that, the Shastra is telling that with the hand there will be 17 types of massages. The ideal stimulation is possible with the different parts of hands. Just this aspect of hand, this aspect of hand, this aspect of hand, this type, this type. So if we want to stimulate a particular marma point, we need these particular areas to stimulate. Because of that only, there will be different types of massages are there. And one more thing is, when you stimulate a marma point, there will be a derangement of prana from there.
Okay.
There will be a vital energy derangement will be there.
Okay.
So it will go to next point. Why means, one marma point if you are stimulated,
okay,
there will be a derangement of vital pranas sometimes.
Okay.
And it will affect the next point. Why means it is all are in the main streams. if it is in the nervous system or in the arteries or are interrelated to the spinal cord, to the whole brain and other things. So whenever we will do a stimulation to a particular marma, we have to look into the other primary marmas and their connections.
Okay.
So for each marma points after stimulation, it need a course of specific pathway for the massage.
Okay.
For that purpose, sometimes we will need a pulling, sometimes we need a pressing like lines separate. So just like some meridians of our body.
Okay.
So there are certain meridians of the trunks and certain meridians to the hands. So we have to interrelate all these vital points through these meridian like movements.